Preparations have been made here in Connecticut in case of the worst case scenario. Governor Malloy has been briefed on the situation, and hospitals are keeping detailed checklists. UConn Health says they're not leaving anything to chance. Fox Connecticut's Charlton joins us from the newsroom with more on those plans. John?
Audrey, UConn Health says the hospital has actually been preparing for weeks since the beginning of the Ebola outbreak in West Africa. The CDC has been stressing preparation and action plans at all health facilities. Connecticut has been isolated from the problem so far, but the fact that we're located between major international airports in New York and Boston, doctors say Ebola is never really that far away. Anyone could be rushed in or walk into the emergency room at UConn Health. That's why the hospital and its chief of infectious diseases realize, perhaps now more than ever, that proper protocols must be addressed and followed.
We screen patients who come into the emergency room for Ebola-like symptoms, get an appropriate travel history.
That same kind of information was reportedly recorded but not properly conveyed at Texas Health Presbyterian Hospital in Dallas. So Ebola patient Thomas Eric Duncan was allowed to leave the ER only to return a few days later. Now it's being reported that Duncan was in Liberia helping to care for people infected with Ebola.
Certainly having been in a medical setting in West Africa, or working with bodies or touching bodies of someone who's been infected with Ebola, that sort of thing would put them at high risk, and we would take appropriate precautions.
If it would ever come to the point that a patient here at UConn Health had Ebola, the hospital says it's fully prepared to isolate and treat that patient.
The emergency room drills for not only biological hazards, but radiologic hazards and chemical hazards. We have protocols in place that would bring a person to an individual room. We have specific rooms that are identified, protocols for how to don the appropriate protective gear, how to deal with any medical waste that happens.
There are also protocols for testing, such as taking blood, which the CDC actually analyzes for Ebola.
The turnaround time is usually a day or two. Sometimes there's a follow-up test that needs to be done.
And UConn Health says hospital departments continue to meet about the Ebola situation and therefore review protocols. Doctors stress that even if an Ebola patient is admitted, other patients shouldn't panic because hospital standards should effectively isolate the patient and therefore contain the virus. Charlton, Fox, Connecticut.